Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss what Tourette Syndrome is, its signs and symptoms, Tourette Syndrome and epilepsy, diagnosis, and treatment options. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified of future videos. Please click on our donate link in the description section below and donate today. Your donation helps us to make a difference for those battling epilepsy. We appreciate your support. According to the National Institute of Health, Tourette syndrome is a neurological disorder characterized by sudden, repetitive, rapid, and unwanted movements or vocal sounds, also known as tics. There are two types of tics, motor and vocal, which can be simple or complex. The first signs of Tourette syndrome are tics. Simple tics are brief and involve a limited number of muscles group, whereas complex tics are more coordinated patterns and involve several muscle groups. According to the National Institute of Health, the following are examples of motor and vocal tics someone with Tourette syndrome can experience. Motor tics: simple, eye blinking, facial grimacing, shoulder shrugging, head jerking, and shoulder jerking. Complex: facial grimacing combined with a head twist and a shoulder shrug. May appear purposeful, including sniffing, touching objects, hopping, jumping, bending, twisting. Vocal tics: simple, repetitive throat clearing, sniffing, barking, or grunting sounds. Complex: repeat words, phrases, repeat others' words or phrases, use vulgar, obscene language or swear words. Children with Tourette syndrome are more likely than the general population to develop epilepsy. 4% of children with new onset Tourette syndrome are likely to develop epilepsy within the following years. Children with epilepsy, especially intractable epilepsy, are likely to develop Tourette syndrome. The challenges people with epilepsy and Tourette syndrome is receiving proper diagnosis before treatment can begin. Many people with Tourette syndrome and epilepsy have been misdiagnosed with conversion disorder and other conditions before receiving the correct diagnosis. Diagnosis of Tourette syndrome can be challenging. Simple tics can be mistaken for myoclonic epilepsy, and complex tics may be mistaken for complex partial seizures. According to Mayo Clinic, the criteria for a diagnosis of Tourette syndrome includes both motor tics and vocal tics are present, although not necessarily at the same time. Tics occur several times a day, nearly every day or intermittently for more than a year. Tics begin before the age of 18. Tics aren't caused by medication, other substances, or another medical condition. Tics must change over time in location, frequency, type, complexity, or severity. According to Mayo Clinic, the following are treatment options for people with Tourette syndrome. Medication that blocks or lessens dopamine can help with controlling tics. Botox injections. Injecting into the affected muscle can help relieve simple and vocal tics. ADHD medications. Medications such as methylphenidate and medications containing dextroamphetamine can help to increase attention and concentration. Central adrenergic inhibitors. Medications such as clonidine and guanfacine, typically prescribed for high blood pressure, can help control behavior symptoms and impulse control problems and rage. Antidepressants. Fluoxetine can help control symptoms of sadness, anxiety, and obsessive-compulsive disorder. Anti-seizure medications. Studies have shown people with Tourette syndrome responding to topiramate. Levetiracetam has also shown improvements in occurrence of tics, behavior, and school performance in children with Tourette syndrome. According to Mayo Clinic, the following therapies can help with symptoms of Tourette syndrome. Behavior therapy. Cognitive behavioral interventions for tics include habit reversal training, can help to monitor tics, identify premonitory urges, and learn to voluntarily move in a way that's incompatible with the tic. Psychotherapy. Along with coping with Tourette syndrome, psychotherapy can help with other problems such as ADHD, obsessions, depression, or anxiety. Deep brain stimulation for tics that do not respond to treatment. Deep brain stimulation may be another treatment. Deep brain stimulation for Tourette syndrome is still in research stages. It is used for patients with refractory epilepsy. In conclusion, according to the National Institute of Health, Tourette syndrome is a neurological disorder characterized by sudden, repetitive, rapid, and unwanted movements or vocal sounds, also known as tics. There are two types of tics, motor and vocal, which can be simple or complex. Simple tics are brief and involve a limited number of muscle groups, whereas complex tics are in more coordinated patterns and involve several muscle groups. To be diagnosed, along with both motor and vocal tics needing to be present, the individual must be under the age of 18, been experiencing symptoms for a year, are occurring daily or almost daily, and are not being caused by other forms of treatment or conditions, and changes in the amount and frequency that the tics are taking place. Medication, behavior therapy, and psychotherapy are treatment options. Deep brain stimulation is in the development phase for individuals with Tourette syndrome. To learn more about Tourette syndrome and epilepsy, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos and subscribe today. You have the power to defeat epilepsy.